Hello, YouTube. I'd just like to share my personal experiences as far as it relates to dealing with keratoconus. I've always had perfect vision, as a child, on up until I turned 25. Then I started to see a decline, so naturally I go to the optometrist, glasses are made, yada yada, bing bang boom, problem solved, at least for a few years. Then I start to notice more of a decline. I need stronger glasses. So I go to a more reputable optometrist this time around. And that's when I'm initially diagnosed with keratoconus. I want to say I was 28 or 29 years old when this happened. Yeah, 28 I think. So you can imagine my surprise when the doctor tells me I have this disease that just randomly occurs in nature. 1 in every 2,000 people at the time, although you fast forward to today, and it's more like 1 in every 500. So it's become a lot more common since I was initially diagnosed. So we decided to try and treat the symptoms because there's no real FDA-approved solution to solving the stability problem. You can only treat the symptoms that come as a consequence of having keratoconus. So I tried the Synergize hybrid lenses, which did a great job of improving my vision even in my worst eye, which would be my right eye. The problem came in with them being not so comfortable, probably due to the hard RGP lens center, not so much the soft skirt on the outside. I could wear them for about 4 to 5 hours, and then anything more than that, and it felt like I literally had to peel them off of my eyes, and then I could hear my eyes screaming thank you once I took them off and just started using my glasses again. So I've gone, since my initial diagnosis, I tried the contacts for a few months and wound up sending them back, just getting glasses. And I've upped my prescription in the glasses a couple more times until recently. Last week, after some advice from Dr. Young Choi, who is a corneal specialist here in Birmingham, Alabama, he suggested that I have intacs placed into my eyes. Unfortunately, none of this is covered by major medical insurance, or at least not as far as the entire cost. Some things are covered, but the ring segments will not be covered, and the use of a femtostat laser is also not covered. They would prefer hand tools be used, which is much more risky and a whole lot less precise. So basically, to have the intacs and the corneal crosslinking procedures done, and this is per eye, not for both, to have each procedure done for just my right eye, since I decided to do the worst eye first to try to avoid that corneal transplant. $7,000 in total, $3,500 for the intacs, and then another $3,500 for the corneal crosslinking. The whole procedure, the intact procedure, took about 20 minutes. And then the cross-linking, which we did back at his office, took maybe half an hour or so. From start to finish, maybe 45 minutes, because there was some soak time done before the start of the application of the UV light. That's key in the corneal cross-linking process. Not gonna lie, folks, the day of the procedure, the day after, it sucked to be me. And not just because I'm fat either, but because my right eye basically felt as if Freddy Krueger ran his razor fingers through my eyeball, poured gasoline into it, and then lit it on fire. It was by far the worst discomfort I've ever felt. And despite having leftover pain medications from a knee surgery I had early last year. Nothing really seemed to make a dent in it except just keeping my eye closed and basically trying to sleep as much as humanly possible. Because if you're asleep, you can't really feel things, right? By the third day, things had started to feel better, where it was less of a burning thing and more of just a kind of scratchy sort of thing. And of course, the doctor gave me a couple of different drops to use. One was probably a pain relief drop, and I believe the other was an antibiotic drop to make sure that infection didn't set in. By day 4, my eye felt pretty much normal, where I could keep it open. I was able to drive by the time day 4 came around. And I'm 9 days post-op now, and my eye feels perfectly normal again. As far as the vision goes, I've seen some differences, and then I kind of haven't. As far as reading things, I don't see much of a change, but I can tell you that my vision is just as good, if not better, without my glasses in my right eye, which is the one I had the surgery on, as it is after I put my glasses on. So I can tell there's definitely an improvement there. And then also, I don't notice as much nearsightedness anymore. So I feel like my depth perception has gotten better. And I also don't notice as much light sensitivity, so driving at night has become much less problematic for me. I had my 9-day follow-up appointment with Dr. Choi today to make sure my eye was healing as it should, and everything is great. I actually start the fitting for a mini scleral lens Wednesday of next week, which I'm really excited about. With that, between that and the intacs and the crosslinking, I should be able to see better out of my bad eye than the corrected vision in my good eye now, which is really exciting. There is hope for anybody that's out there thinking there's no way that I can deal with this and I just need to bite the bullet and do this corneal transplant deal. There is hope. Unfortunately, the FDA has not approved much in the way of the procedures so that Major Medical will cover these things. So, you have to be really serious about this, and hopefully, you can come up with the money to take care of things. I personally got some help from my parents because obviously they didn't want me to lose sight in one of my eyes completely, and they understand the risk involved with a corneal transplant as well. So that's where I'm at. In a perfect world, I would have gotten both of them done at the same time, because ideally, you want to stop the progression of the keratoconus, which is what the intacs and the corneal cross-linking, when paired together, have been shown to do a pretty great job of. There's a whole lot of different possibilities now. I'm probably going to look into seeing if my left eye is available to be filed under Major Medical, if it meets the criteria for as far as corneal thickness goes, and maybe get that done towards the end of the year. Because even with medical coverage, that's still $5,600 altogether to be paid out of pocket to have the procedures done on the other eye with medical coverage. So it's not exactly something you can just whip out the old checkbook and take care of all willy-nilly. At least not when you're a blue-collar working man like myself or my family. But, there's hope. If I can see this well out of my bad eye now, after I get those contacts, I'm really excited for the possibilities of what can happen once my good eye gets fixed. I will continue to post videos probably at the 1 month mark, 3 month mark, 6 month mark, because you're really supposed to see the benefits of the corneal crosslinking between the 3 and 6 month marks, as it takes time for the riboflavin proteins to stiffen up inside the eye. So I will keep you guys posted from there, and I hope this helps answer some questions that anybody that's considering having these procedures done, you know, any questions you guys might have, you know, you can always leave me a comment and I'll be glad to respond, or send me a private message. More than welcome. I'll tell you everything I know and everything that my experience have been up until this point. And I hope you guys have a blessed day. Peace.